cubicle, but the cubicle will be divided into two parts. There's a partition. There's a partition in the middle, and there's a table and a chair on one side, and a table and a chair on the other side of the partition. As soon as you enter the cubicle, examiner will receive you. He will say, "Doctor, you sit on that side. I'll be sitting on this side of the partition." There's a telephone on your table. There's a telephone on your table. When you're ready, you pick up the phone, and then we will speak over the phone. Yeah. When you're ready, you just pick up the phone. You don't need to dial anything there. Don't need to dial. Just pick it up. It rings on my side. Then I will pick it up, and we will speak over the phone. That means you're not actually seeing the person because there's a partition. So you're actually talking over the phone. Sometimes the question will say you are an SHO, you talk to the consultant or you talk to the registrar. In that case, there are only two people, because you will be sitting on this side as an SHO. The examiner will be sitting on the other side, who will be acting like a consultant or the registrar. Or sometimes the question will say there's a mother who is at her home. She is calling the hospital doctor to take advice from the doctor, saying that my child has got a diarrhea. What should I do? Should I bring my child to the hospital or not? Okay, so in that case, you will be the doctor sitting on one side, mother will be sitting on the other side, and examiner will be sitting in between you, so that he can see both of you. Right? So sometimes there are two people, sometimes there are three people in a telephone conversation station. Okay. So this is one of the telephone conversation stations which I am telling you now. The question says it's a middle-aged lady, say about 45-year-old lady. She is in the ward already. Okay, she is in the ward for some reason, some medical problem. Someone inserted a central venous line. Someone inserted a central venous line in the morning. Yeah, 8 a.m. whatever it is. In the morning, somebody inserted a central venous line, and she became short of breath after that. She is short of breath after that, and you have examined this lady. You have examined the lady. In the question, there are a lot of things written. You found blah blah blah, so many things. I can't remember because people can't remember everything what is written. It doesn't matter. So you have examined this lady. Because you are the ward SHO. You are the ward SHO. You are the ward SHO. You have examined this lady. You talk to the consultant. Talk to the consultant over the telephone. Yeah, imagine Dr. Brown. Yeah, your consultant is Dr. Brown. Talk to your consultant, Dr. Brown, over the telephone. So you are the ward SHO. So, read this question. As I said, you will be outside the cubicle when you're reading. When inside the cubicle, examiner will receive you, and you will not be sitting on that side of the partition, I'll be sitting on this side. How many people are there in this station? Two. So I'll be sitting on this side. When you're ready, pick up the phone, and then we will speak over the phone. So, go inside the cubicle, that side, other side, pick up the phone. When you're ready, he will pick up, then he will say hello, you will say hello, then I'm Dr. So-and-so. Yeah, I'm the SHO in this department. Can I speak to Dr. Brown, please? Can I speak to Dr. Brown, please? He will say, yes, doctor, how can I help you? Then say, well, Dr. Brown, I have a patient in the ward. I need to speak to you urgently regarding that. Is that all right? Okay, doctor, tell me. Then you say, whatever you see in the question, mention that. We have a lady, 40-year-old lady in the ward, blah, 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 for this reason, and someone inserted a central venous line for total parental nutrition. Yeah, someone inserted a central venous line for total parental nutrition in the morning, and she has become short of breath after that. And examine, I have found these things. Whatever else is there in your question, mention that. Then he will ask you, okay, doctor, what do you think it is? Okay, tell me the details. What do you think it is?
Pneumothorax.
Pneumothorax, it is pneumothorax. Tell me the other details. Tell me other details.
Chylothorax, hemothorax.
Pneumothorax.
Chylothorax.
Chylothorax. Chylothorax.
Yeah.
If it is
Chylothorax.
Hemothorax, pneumothorax, okay, agree. Tell me. Can you kill a patient when you're putting an IV cannula?
Yes.
Air embolism. Which can happen here also, isn't it?
Air embolism. But that is in the morning. That it will immediately, you will kill your patient, if you do it.
It can happen, but you don't well, it
Yeah, it
depends.
will be immediate. If the scenario is in the morning, then the most likely it is something slow, not air ambulance.
What I'm saying is, well, it depends on how much air you inserted, isn't it? Not all the patients, even patient will die
If
immediately.
the air is, I mean, it's not that much,
Yeah.
then air will be absorbed by the pulmonary or the heart,
But can he have some area, not very much, not a big air embolism, not a small embolism? Can medium size? Can he have a problem? Can she have a problem? Yes. Okay. What else? Pulmonary edema. How? Fluid overload. Yeah, you're given too much. If you're given too much of fluid, that's a total parental nutrition. Fluid overload. Okay. What else?
Fat embolism.
Fat embolism. That is, this is not a fracture.
No, it depends on the formula.
Okay. These are the complication of a central venous line insertion.
Other.
But she can be short of breath because of other problems, other than the related to the central venous line insertion.
Other.
So what is the first thing you think of anybody short of breath? What is the first thing of your mind?
Pulmonary embolism.
Pulmonary embolism. Pulmonary embolism.
Yeah.
First thing to think of is a P. Pulmonary embolism.
Pulmonary
Yeah.
embolism.
Any patient short of breath, first thing you think of is a P.
Pulmonary.
That too, this patient is in the ward already.
Yeah, already.
Yes, she would have been bedridden patient. Okay, so P, that's the thing. So what else? Yes, it is not the MI, it's a complication of MI. What is that? Heart failure.
Heart failure.
She may be short of breath because of heart failure. Or asthma, maybe acute exacerbation. Acute exacerbation of asthma, maybe. Okay, these are your DDs. Yeah, these are the things what you'll be thinking about in this patient if somebody is short of breath. So then you're like, okay, doctor, in the exam, say pneumothorax. Yeah, just say pneumothorax. I think it is pneumothorax. Leave it there. But if the exam asks you, doctor, what are your other differentials? What are other possible things you think of in this patient? Then you have so many other things. But in the exam, they will ask you, doctor, okay, what have you done for this patient? What did you do for this patient? Any short of breath. The first thing is oxygen. First thing is oxygen. I give an oxygen. What else? Propped up. He has chest problems. I kept her in a propped up position. Fine. Any chest problems. Always propped up. Okay, what else? ECG. Okay. ECG. Short of breath. ECG. Why? Arrhythmia can cause short of breath. Okay. Or MI. Yeah. So ECG. Fine. Okay. What else? What else? Blood test you do? ABG. Yeah. Any short of breath, you will do an ABG. Of course, you won't have any results of the ABG here in this station. What else you do? Chest X. I've done a chest X. So what do you think you will see inside the cubicle in this patient? You will see a chest X, which you have supposed to have done. So on your side, on your partition, that side of partition, you will see an X-ray box and see an X-ray on your side, which you have done. So you need to tell the